आज हम बात करेंगे rotator cuff injuries के बारे में. They're basically a group of 4 muscles that stabilize your shoulder and help to lift and rotate your arm. You can remember it by the mnemonics SITS, S-I-T-S, supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles basically keep the ball of the humerus, which is the arm, to the socket of the shoulder. Now let's come to the injuries of the rotator cuff. First is tendonitis, which is the inflammation of the tendon basically from overuse. The second one is the bursitis, which is the inflammation of the bursa, which is basically the cushioning sac. The third is the partial tear, in which the tendon is damaged but not completely. The next one is the full thickness tear, in which the tendon is completely detached from the bone. Now, some of the symptoms that you feel when you have a rotator cuff injury is dull ache deep in the shoulder, pain when lifting or lowering your arm, weakness in the arm, difficulty sleeping on the affected side, clicking or crackling sensations. Now, some of the causes could be overuse, specifically in sports injuries. Second could be aging, very common after 40. Acute injury, this could be caused by falling or lifting something very heavy. And then poor posture or mechanics. Now the examination could be by physical examination and imaging techniques. In physical exam, you can perform special tests, which will test the strength of the muscles and also specific movements. In imaging, you can perform MRI or x-rays like that. Now the treatment of this is basically surgical or non-surgical. Non-surgical is actually the most common, in which you can focus on rest and activity modification, ice and anti-inflammatory medications, physical therapy, which is the key for recovery, and then corticosteroids, or in simple words, steroid injections. Treatment plan. So in physiotherapy, we mainly have to decrease the pain and decrease the inflammation or swelling, restore the range of motion, improve strength, correct biomechanics, and prevent recurrence. So in phase 1, which is the acute phase, we basically have to focus on the decrease of pain, which you can do by TENS, IFC, rest, ice, gentle pendulum exercises, and passive range of motions. Phase 2 is the mobility or early activation. In this phase, we can perform wall climbing,